what we speak about in the way of opiate dependence is what we call biopsychosocial illness. One's biological or physiological makeup, so one's physical appearance, one's psychological well-being, meaning how they're perceiving the world and others, and of course socially, how they're interacting with other people and who those other people are. So I think it's really important for parents or for loved ones to take a look to see if their child or their family member is having issues with heroin or other opiates, is to look at that physical appearance. There's a couple of things that happen far along the progression of opiate dependence, what we call ADL skills, activities of daily living. So personal hygiene tends to take a loss, the brushing of one's teeth, personal grooming, the combing of one's hair. You have to understand that opiate dependence as a psychiatric illness becomes this type of obsession and compulsion. Obsessions are recycled thoughts. I need another. I need another. And they lead to compulsions, which are repeated behaviors. I take another, whether it's nasally or intravenously, I take another, I take another. And of course, narcotics like heroin or other opiates, the most powerful drugs on the planet. So this becomes all-consuming in their focal point, and of course their physical health or appearance tends to be compromised. So when we talk about activities of daily living, not showering regularly, because opiates can often be an appetite suppressant, they tend to lose some weight and look very gaunt. Sleep patterns get thrown off, either what we call hyper or hypo, too much sleep because of the lethargy that opiates bring, and sometimes they refer to it as the nod. People tend to nod out. Remember, opiates are painkillers, which means they suppress bodily functions. Okay, so they slow down heart rate, they slow down thoughts per minute. And for some, they tend to appear very lethargic and slow-moving. Even speech gets very slowed and tried. So some of the physical appearances that you'll see would be the weight loss, the too much or too little sleep, obviously not really venturing outdoors, so kind of a pale or grayish look.